And these sorts of figures are being used now much more in the sort of the climate change debate when we're trying to think about some of the mitigation options in relation to urban design for climate change purposes. And I was interested this morning, you were talking, so in the social, if I'm remembering correctly, the social housing was the worst, am I remembering correctly, Philippa, well, let me come back to that point, because what we found in the UK, the idea, so the different tenure and the quality of housing, I thought was quite interesting. There was the private rented houses that were less decent compared to the social rented, compared to the owner occupied. And what has been proposed in these, what's behind these data has been some very good housing policy in terms of affordable quality housing amongst that social rented sector, not to the detriment, so that's great, but it's that sort of unregulated private rental area that's creating problems. This is an area in Africa, again from the UN Habitat's recent report. And to me that image says an awful lot about a whole variety of social determinants of health and health equity. It's posed in the discussion in the report, the state of the cities. It's about waste management, what needs to be done for urban waste management. But if you look at the image, what's happening is, and this is often the case, is children are being kept, well this is a very young child, it's not entirely relevant there, but children going into the pickings, you can make money out of the pickings among the waste, and that's often both the informal work and the children. So it's got implications for what your education policy would look like, implications for child care amongst the informal sector. Often there's no notion of child care, and so what does that mean for female empowerment along the way? Poverty alleviation and then work issues. So it's not just waste management. That, to me, that urban setting suggests that you need to think about that policy coherence and that integration across a whole range of sectors. And I can't talk about, I can't talk about anything ever without talking about food. It's one of my areas of work. But just what I was saying about the obesity epidemic and how it has started just about everywhere around the world. The obesity epidemic starts in the city. So that urban nutrition transition. And this image is the picture of a deep-fried Mars bar, which is, well, we like to claim it in Glasgow as, well, in Scotland as our national speciality, but I do believe you have it here as well. We sent it over to you, so I'm sorry for that. But what has happened in that urban, so thinking about food retail, thinking about the food system in the urban setting, making different sorts of foods available, readily accessible, very affordable. So you can get a deep-fried Mars bar in a whole variety of fast food outlets across Glasgow, so readily available. It's also relatively cheap. You go into the chip shop and you buy your deep-fried pizza and you buy your deep-fried Mars bar, and it doesn't cost you an awful lot of money. And it's become much more socially acceptable. It's true. It's now on the menu of some of the more well-to-do restaurants in Glasgow. So it's just how the positioning of food and the, within that urban setting can change our nutrition patterns. And of course, we don't want people to eat more. It's really nice, but you only want a little bit very rarely. And from an equity perspective, thinking about how food is distributed within the urban setting can really play out. This some data from the UK where they costed a basket of healthy foods, and the healthy basket of foods, so it became more expensive over time, that's fair enough, between 1988 and 2007 it all became more expensive. We all experienced that around the world. But you had this double hit if you were living in a low-income house, a low-income neighbourhood. These are from cities in the UK. So not only were you sort of poorer to begin with, but you've also to comply with those dietary guidelines that we espouse, then it's going to cost you more if you're in that low-income neighbourhood. So what food gets into the urban environment and how it gets into the urban environment and how much it costs has major implications for health equity. I just want to mention a piece of work that we're about to do in Australia, which is trying to bring together that idea of equity and of environmental sustainability, looking at the different food subsystems in the urban environments, and I would really be interested in see how we could do that in combination with yourselves. Because what it's looking at is what are the urban food systems that are in place, what do they provide, and are they providing nutritious food in a sustainable way? Are local food production systems there, and are they more sustainable or not than some of the other supermarkets, for example? I don't think we know that conclusively. And then, well, you can read the idea of access to the different foods, how affordable are the different foods coming from. So when I say the different food subsystems, that would go from the retail environment through to your local garden, through to your community gardens, etc. If, sort of going back out now, thinking about what is it that's driving urbanisation and what is it that's driving it in a way that is it about economic growth, or are we being conscious of health or health equity or human development in its broad sense? Then if we are concerned about that, we do have to think about sort of the macroeconomic and the industrial policies, these big global policies that come through to that city level. And if you look at some of the drivers of urban growth in some of these regions in the world, the one that dominates is investment in transport infrastructure, which of course is really important. If you think about getting food to the market, what has been a barrier for that economic development through food and agricultural production in some of these countries around the world has not been able to get to a market to sell. So the investment in transport infrastructure goes a long way to help economic growth. But what has happened, some of the other considerations, is that the transport infrastructure is put in place. It's not thought about from a public equity perspective by any means. It's the big thoroughfares that takes the big trucks and so on. So there's no getting in at that point of deliberations could go an awful long way for health equity purposes. And so if we do live in an urban world, which is what we do, and many countries are rapidly increasing in terms of urban development to the detriment of rural living, which of course for some countries there are still large majorities of the population are in rural environments, which are being slowly depleted of services, of supports, of community in a way that's impacting on health and health equity. I imagine that is also happening here in New Zealand.